How many of us find ourselves in this position for prolonged periods of time, sometimes up to 8 hours a day? I'm John Nunez, a physical therapist at the Center for Physical Therapy. So today we're going to talk about the cause and effect of neck and shoulder pain and some very simple and easy exercises we can do at home on a daily basis to help alleviate this pain and improve our quality of life. The first thing we want to understand is the natural structure and function of our head and cervical spine. Our head sits atop of a naturally curved cervical spine, as seen here, on top of all the vertebrae and in between both of our shoulder blades equally. Its job here is to absorb the normal stresses and be able to accommodate all the functions associated with daily activities, with work and recreation. Muscles in our back, along the back of the spine, and into our shoulders all make up a tight little triangle which is supposed to provide dynamic support to our neck to keep us upright. The giant muscles in the neck, called the trapezius, come down along the back of the spine and along to the sides on each of the shoulders, and again provide dynamic support to keep our spine upright. In the front, we have our scalene and our neck muscles in order to allow us to move to side, but can also become very tight and rigid, limiting our motion and causing back pain. The head moves in many different directions on top of the cervical spine, and the spinal segments are exactly responsible for allowing all this mobility equal in all directions. The neck is supposed to go front and back, side to side, and also rotate right and left. A proper balance between the anterior and posterior muscles of the cervical spine in and around the head are responsible for preserving motion in all directions and equal motion in all directions. When something starts to get limited, we're going to start to get breakdown at each of the individual joints, and we're going to start to get more pain and more limited motion. These are going to start to limit our activities, and we have a natural background where we want to protect ourselves, so we stop moving, and then this also limits motion and starts to further progress our injury. Now that we've had our anatomy lesson, where do we go from here? It's important to understand these signs and symptoms associated with neck pain or poor posture or even a muscle imbalance from the back to the front. Oftentimes we're sitting at work and we may get a little neck pain where we have to rub it out or feel like we need to stretch our muscles or improve our motion. Other times we can be sitting at home, we go to reach for something in the kitchen cabinet or go to handle things and we start to get neck pain and shoulder pain. A lot of common signs and symptoms are associated with having neck pain and poor posture. First thing you can notice, you can have a friend look at you or you can look yourself in a mirror. One of the first things that we'll notice is that we have a forward head and rounded shoulders. Both of these combinations here create that muscle imbalance from muscles in the front or anterior to the back or the posterior. The muscles in the front get very tight, muscles shorten and lengthen, and as the neck comes forward and the shoulders come forward, all the structures in the front adaptively shorten and become very tight. Conversely, all of the muscles in the back, which is supposed to keep us nice and upright, or our postural muscles, get overstretched. And the important thing to know is that a lengthened muscle is not exactly a strong muscle. Therefore, our muscles in the back are not able to keep our spine upright or keep our shoulder blades down in the proper position, which is why we may get shoulder pain if we reach for something, or it's difficult to lift our head up because the muscles are weak and they can't handle the natural stresses throughout the day to keep us upright for 8 hours while we're working, walking around, or doing our other activities. Fortunately, there are many easy things that everybody can do at home using everyday objects or using nothing at all in order to help preserve motion and restore proper posture to address neck pain or shoulder pain. The first thing that we want to do is address the cause, our posture. We don't need anything. Just try and stand up nice and tall, pinch your shoulder blades together, and try and keep your head up nice and tall. More often than not, we're sitting at a desk, working at a computer screen that's too low, so our neck is always facing downwards and our eyes are pointing downwards. So we want to lift the chin up a little bit and pinch our shoulder blades back. Again, sometimes it's easier to have a friend help you or do this facing a mirror or sideways in a mirror so that you can see your own posture. Another tip that I like is getting in the car. Oftentimes we're relaxed in the car, the cushions are very soft, similar to sitting in a sofa. What we can do is use our rear view mirrors and our side view mirrors to help address this. The first thing I do is get in my car, put my back seat up nice and tall, and adjust my mirrors in what I think is good posture, so that any time I start to slouch, I won't be able to see in the mirror. And it's a nice little visual reminder that I can fix my posture instead of slouching again. It takes time, it's not going to fix overnight, so be patient with yourself, and over the course of a couple weeks, you'll start to notice that you can tolerate better posture more and more, and you don't get that awkward sensation of trying to stand up nice and tall. The muscles will adapt, and your posture will be better. There are also some therapeutic exercises that we do in the clinic and are common in many clinics to address similar symptoms and injuries. The first thing that we want to do, again, is strengthen what's weak, stretch what's tight, and improve range of motion. At the neck, we can address neck pain just by simply improving motion in all directions. You'll find that if you start to go forward and back, side to side, or left to right, you may notice that there's one area or one direction where you're limited more than the others. Don't force it into these directions. Motion will come over time. It's important to let the neck and the muscles warm up in all different directions. Just because a little stretch is good does not mean a bigger stretch is better. So gently take your neck through all different motions, pain-free, and you'll notice that maybe after 30 times in the morning, maybe 30 times in the evening, over a course of a couple weeks, you'll start to notice you have more motion and the muscles will loosen up. This active motion helps restore blood flow, loosen up the muscles, and lubricate all the tiny little joints seen in the cervical spine. We need to strengthen the postural muscles as well. We talked about the muscles in the back being stretched as our shoulders round forward. So what we need to do is pull them up nice and tall with our good posture and then strengthen them. Our shoulder blades are pulled together to the middle of our spine with smaller sets of muscles. What we can do are called scapular retractions. Stand up nice and tall and pinch your shoulder blades together, just as if you were trying to pinch a quarter between them. You can hold it for 3 seconds and then relax. The repetitive contractions will gradually build strength and endurance in these muscles, and your shoulder blades will be able to sit down properly right along the spine as they were meant to be. The combination of all these activities, improving the motion at the neck, strengthening the postural muscles, and even some stretches for the front will help restore a proper balance between the anterior and posterior muscles and help alleviate some of the stresses due to poor posture and poor range of motion. I'm John Nunez from the Center for Physical Therapy. That was this week's tip for the Weekend Warrior segment. We'll see you next time.